Okay, you have an order to put a foley in Mrs. Jones, so I'm going to show you how to do that. So, first of all, you want to make sure that you verify your order. You want to gather your equipment. And so you come in, you identify your patient. Hi, my name's Debbie, and make sure you provide lots of privacy. Hi, my name's Debbie. I'm going to be your nurse today. Can you please tell me your name and your date of birth? Are you allergic to anything? Especially you're looking for latex or iodine. Are you allergic to shellfish, iodine, latex? No? Wonderful. So I want to go ahead and get my patient, get my gloves on, wash my hands, get my gloves on. And I'm going to go ahead and just do some cleaning on my patient. I want to make sure to set the bed to a comfortable working height for myself. I don't want to hurt my back. And it's a female, so I'm going to put her in dorsal recumbent position. I want to make sure that I'm able to actually easily get to the position to get to her hairy area to help her to clean it. So that's why I want to put her in a dorsal recumbent position. So I'm going to just do general cleaning first before I do the sterile cleaning. So I'm going to put her head back. Raise the bed up a little bit higher. As long as she can tolerate having her head down. Get my warm water ready, my soap and warm water. And I'm going to go ahead and cover her this way, and I'll bring the covers back this way, you know, so she feels a little bit more secure. All right. And only expose what actually needs to be exposed. And I'm going to put her in a dorsal recumbent position, legs spread apart. And then I'm going to go ahead and clean my nice soapy water. One area, clean top to bottom, a new area of the cloth, top to bottom, top to bottom, dry. Then go ahead and take my gloves off and wash my hands. Okay. All right, so get that stuff out of your way. You want to have your bedside table. Again, bedside with lots of privacy and good overhead lighting. When I was cleaning, this would be the time to make sure that I can see, what I'm doing. So, you know, make sure you spread the labia, and so that you can get a good visual and know where that urinary meatus is. So I open my catheter. In the catheter kit, you'll see what is actually in here. So it tells you there's a closed system. It's a 14 French. It's how big the bag is, how big the balloon is, all the things you need. It tells you what size your gloves are. So if you know that you're not a medium gloves in here, you would probably bring in a small or large pair of sterile gloves. So I'm going to take the outer bag, and I'm going to use that to help me to put my dirty supplies in. Again, remember, put it in a place where you know that you're not going to cross over. You could put it into the bed, which would be fine. Just make sure when you use your dirty sterile, your dirty catheter, either your cotton ball swabs or your applicator tip swabs, that you actually don't cross over your sterile field. Okay. So I set that up. Now I'm going to use my overhead table to open up my kit. And again, remember how you always open up a sterile kit. It's away from you first. So away from me, then I open up the sides towards me. Now, depending on how it's packaged, some kits are packaged where the sterile drape is on the top, and some are packaged with the gloves on the top. If the gloves are on the top, you can put the gloves on first and wrap the sterile field around your hands this way, or you can do it the way I showed you in lab. In this kit, the sterile drape is actually on top. So I know that I have to put my sterile drape on first. This is the only touch the corner. So I pick it up and I put the shiny side down first, the shiny or the blue side. And I don't want to hover all over my sterile field, so what I do is I kind of drop it like this, just like you learned for the wound, and I kind of, ma'am, can you lift your legs up a little bit, lift up, and I just slide it. Being careful not to come over here and get too far into my sterile field. All right? Now, I'm going to pick my gloves up, being careful not to touch my all the rest of the stuff in my sterile field, and I put them off to the side. I want to go ahead and come down and touch non-sterile to non-sterile, sterile to sterile. So I'm going to go ahead and put this down here at the edge, right here. So I've got a nice sterile field. Now I cannot go touching the fenestrated drape until after I put my sterile gloves on. So I'm going to put my sterile gloves on first. Again, I want to keep an eye on my sterile field. Do not turn your back to your sterile field. Again, how do you put on your gloves? Remember, you open up your package. It's away from you first. You open towards you. Then you put your fingers on the inside of the package, not all over the package, just on the inside of the package, and open it up. Okay? So once I got this open, I'm right-handed, so I'm going to put my right hand on first. I pinch the glove, and I pick it up. And then I put my thumb in, my fingers in, and I pull it on. Then I take my finger, I'm going to touch sterile to sterile. I'm going to put all of my fingers inside my glove. This right thumb gets stuck out like I'm hitchhiking, and I slide it in again, finding my fingers, my thumb. Keep it up. You don't want this all over the place. And keep your hands sterile above your waist. Now I have this fenestrated drape. I'm going to go ahead and use this fenestrated drape. I can touch anywhere I want on it because I'm sterile, and the shiny side goes down. Don't play with it. This is when you contaminate things if you start trying to play with it too much. Then I want to open up everything in my kit. So I take my kit, and I'm going to consider the inside of the box sterile. Even though I have this sterile field, there's that 1-inch border that wasn't. So I'm going to really work inside my box. So I want to get everything ready that I need. So I open up my swabs, my iodine swabs, and I take them out and I put them on the tray. I'm going to go ahead and open up my lube. Sometimes you have a lube that is in a syringe, and sometimes it's in a package like this. So it's in my package. I'm going to go ahead and squeeze it out onto the tray. Try not to be hovering all over your sterile field. I could take this and drop it in here, or I could come around and drop it in my little bag that I made. Now, if you're dropping in my bag, make sure you don't shove your fingers in that bag because then you'll be contaminated. While I have on my two sterile gloves, I have 2 sterile hands. I want to get everything ready that I possibly can, because at one point I'm going to have 1 clean hand, or you can say dirty if it makes 1 clean hand and 1 sterile hand. So then I want to take my package, I'm going to take the plastic off, again making sure not to hit it on any legs or anything like that. And I want to take my syringe with sterile water and place that onto my Foley. Put that on tight enough. We don't have to test the balloon, but just put this on tight enough that it doesn't fall off. Now, since I'm female, I'm going to go ahead and lube 2 to 3 inches of my catheter. Don't be afraid to lube it. At least know what 2 to 3 inches looks like. If you lubed more, that's okay, but just make sure you get enough lube on there. So I'm just going to leave it right there in my package. Now, take a look before you continue. Take a look and make sure that you have everything that you possibly need done before you go and contaminate your hand. Take a double second. I have everything done. Now I'm going to contaminate my hand. I'm going to take my dirty hand and spread the labia apart. And now I'm going to start my cleaning process with my iodine swabs. I'm going to start away from me first, so clean top to bottom away from me, and not over the meatus, but just to the outer edge of it, like where the inner labia are. Top to bottom. Take my swab. Do not bring it back over here, but take it, toss it in my bag. Now I'm going to do closest to me, top to bottom. Now I'm going to go top to bottom over that meatus. Now that I have that, I'm going to get ready to insert the catheter. Ma'am, take a slow, deep breath. I'm going to bring my catheter bag a little bit closer. It's okay that I touch this box because it's sterile and I'm sterile. And I'm going to bring it closer, and I'm going to go ahead and get ready to insert. Slow, deep breath, ma'am. And I'm going to insert into the urinary meatus, holding this about 1 inch back. And I insert, it's going to take about 3 inches, and I start to see urine. Once I start to see urine, I let the urine flow, and I advance it another 2 to 3 inches. because you do not want to inadvertently open your balloon into your urethra. So I'm going to advance it 2 to 3 more inches. Once I advance, while I'm continuing to hold open with my dirty hand the labia, do not let go of that, because if you do, it's going to become uncontaminated. So once I advance another 2 to 3 inches, then I can let go with my dirty hand and hold on to my Foley catheter. And come back over here and inflate my balloon. Use all of the sterile water that is in the balloon. Now you can need to continue to hold on to the syringe while you take it off, because if you let go, it will want to come back out. So I let go and I come over and I pop the syringe off. Now that balloon is still up in her bladder, so I need to gently pull it back till I meet resistance. Now I take the catheter bag and I need to lower it. I would put a stat lock on here or a leg bag, and I need to put it below the level of her bladder, and it needs to go on the bed frame or the little hook here, not on the side rails. And at some facilities you may have a policy that do not let it exceed 800 to 1,000 to prevent bladder spasms. So I would check to make sure it's not exceeding that much right away. If it is, I would just clamp it off for 20 minutes and then come back and let the clamp out. And that's just to prevent bladder spasms. Clean all up. Since I use betadine, I'd probably go ahead and do another cleaning on her. Just a regular cleaning with soap and water, because that's kind of irritating. Tear all this away, and then I go to document. What would I document? Clean her all up. Clean, 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 pretend. And what would I document? So I'm going to document that I put the Foley in. What did I put? A 14 French inserted, how much I put in the balloon, how she tolerated, what the urine that immediately came out, the color, the consistency, was it cloudy, was it clear, how much, and that I put it in using sterile technique. And I think that's about it. So now let's say I have an order to remove it. Of course this would be clean and all. So I would need to come over and I need to check the chart and find out how much I actually put in the balloon, because it should say, that's what I documented. If not, it's actually going to be on the catheter itself. It'll tell you what the size of the balloon is. So let's say I check the chart and it says that there was 10 mLs in the balloon. It's a 14 French catheter, so of course I come in, identify the patient, name, date of birth, allergies, all that, right? So then I bring my syringe in with me. I take my catheter, my Foley catheter, empty this out and record it. All right, of course this would all be cleaned up. Take this out and record it. Get her in a comfortable working position. Put a pad underneath her. Hook up the syringe, and look how it automatically comes out, starts to come out. So I make sure that all of the sterile saline comes out of the balloon before I remove it. That's important. Make sure it's all out. So now I just go ahead and pinch the catheter and slow deep breath, ma'am, and pull it out. Now that I have it out, so I go ahead and dispose of this properly. Now that I have it out, I want to wash her, clean off everything. And now that it's out, one thing I do want to think about is that she voids within the next 8 hours. I'm going to keep eyes and O's on her for the next 24 hours, but it's important that I check that she voids within the next 8 hours. If not, I am going to call the doctor and let them know. And that is it. Make sure you put the side rails down, give her a call button, make sure she's comfortable, all those other good things that you've learned before. And that is how you put a Foley in and how you take a Foley